My name's Josh, and today I'll be doing a supplement lab video, and I will be going over the elbow joint. The first thing that we would do is talk about the history with the patient. So we would ask them about how they hurt their elbow, how they've hurt their elbow in the past. This could include dislocations or even injuries to the biceps. Next, we would do a physical examination of the elbow. First thing we would do is look for deformities around the elbow joint. And then we would look for different landmarks that are normal to every person. First, we can look at the olecranon process, which is the main elbow prominence. And then we can look at the medial epicondyle, which is located here, and the lateral epicondyle, which is located here. We also have the antecubital space, which is the space between our biceps and our forearm, right in here. We can also palpate for the biceps tendon. For a physical examination, we would next move into range of motion tests. So the first thing we're going to look at is flexion extension of the elbow. This is easiest to do if you have the patient bringing their arms straight out and then ask them to actively bring their hands in and touch their shoulders. Is pronation, supination. So it is easiest to have them stand straight up, bend their elbows, palms facing the ceiling, and have them rotate down towards the ground. Based on the history that we received from the patient, the next thing that we would do is special tests. For lateral elbow pain, it is likely that the patient has something called tennis elbow. A test for that is a Cousins test, and what you would do is you would support their elbow, have them extend their hand against resistance, and if there's pain in this region here at the extensors of the wrist, then it is likely tennis elbow. For medial elbow pain, it is possible that it is something called golfer's elbow. So to test for that, you will have them in a similar position, but now we're going to test against wrist flexion. And if there's pain reproduced in this medial section of the forearm and elbow, then it is likely golfer's elbow. Another thing we can test for is bicep tendinopathy. So for this, we would have the examiner place 2 fingers at the bicep tendon and resist up against elbow flexion. Since I'm doing this on myself, I can't put my hand in both places, but if I were to pull up against resistance, then the patient would have pain on this bicep tendon. Very similarly, we could have tricep tendinopathy. So you would place 2 fingers on the tricep tendon and against resistance, push the elbow out, and there would be pain on the triceps tendons. Another thing we can test for is impingement of the ulnar nerve. This is done by placing 2 fingers or your thumb at the medial epicondyle and forcing flexion and extension if the nerve is felt to pop out of place, and if there's pain with this motion, it is likely that the ulnar nerve is involved. Impingement can also be detected in supination pronation. So on this, you would place 2 fingers on the lateral epicondyle and have the patient bring their hand into supination and pronation. And if there's pain with this motion, it is likely that this nerve is also involved. Next, we're going to talk about something called nerve glide and nerve tension. So nerve tension is when you pull a nerve from both ends of the spectrum, and nerve glide is pulling the nerve one direction or the other direction. The median nerve glide, so we'd hook it around our middle finger. And then this would be median nerve tension.